Welcome, dear students, to this session on management of patients with nose disorders. Nose disorders are very frequent in children, but they are also very common in the adults. And it is important to study them when you are studying medical surgical nursing. And it is a part of your volume 3, block 5, unit 4. So it is important that we talk about various throat disorders as well as various nose disorders and how do they affect you. So starting with the introduction, the nose is a very important part of our body because it helps us to smell and also gives a sensation of various fragrances and aromas around us. But when there is some problem with the nose tissue or some of the glands which are in the nose, obviously there will be problems in the sensation of smell, and also it can lead to various upper respiratory problems like common cold, and these are very common since last year we have been suffering from COVID-19 and we have known how important was it to wear the mask. So your nose is also a part from which infections can enter your body, and you how as a nurse you're able to counter those and help your patients is very important for you to understand. So there are many disorders of the nose, and it is also important to understand that they are also associated with variety of complications. So first of all, the most important problem that affects the nose is the rhinitis. Rhinitis is known as the inflammation of the nasal mucosa or nasal mucous membrane. There are various classifications or various types of rhinitis. They can be infective, acute, chronic, or non-specific as well as specific. Infective rhinitis is of two types, acute and chronic, and the acute rhinitis is non-specific. For example, common cold. Chronic rhinitis is of various types, and it can be depending on what kind of organism is causing those problems. For example, there can be rhinoscleroma, syphilis, leprosy, tuberculosis, and fungal infection. Then we also talk about non-specific rhinitis, just like a allergic rhinitis. So specific rhinitis has a specific cause, whereas non-specific rhinitis is because of allergies. It can be anything: allergy to food, allergy to pollens, allergy to flowers, allergy to some fragrance. So these are the various ways by which your rhinitis is classified. So when we talk about the most common form of rhinitis, we usually say that it is the common cold. Common cold is the simple acute rhinitis, which is also known as coryza or common cold, and affects the both ages and both the genders equally. So any age can be affected by common cold, especially today as we see around us, everybody is specifically suffering from cold, and also when the seasonal variations are there, when the season changes, people usually fall prey to the common cold. The next thing is that what are the various causes of common cold? There are many causes. There can be important causes like viruses such as rhinoviruses, ecoviruses, influenza viruses, para-influenza viruses, and even mycoplasma organisms. They can all lead to common cold. Then there can be secondary infection. What we understand by secondary infection is that your primary infection has happened somewhere else in the body, and the microorganisms from that part are actually going and causing infection some other part of the body. So secondary infection can occur as a result of streptococcus. Streptococcus usually causes strep throat, that is pharyngitis, but this infection can go into your nose and can cause common cold. It can also be because of hemolytic pneumococcus, staphylococcus, and Haemophilus influenza infections elsewhere in the body, which can migrate to your nose and cause common cold. The incubation period of common cold is usually 1 to 3 days. Recently, as I have already talked about, COVID-19 has also been associated with the flu-like symptoms, which can aggravate into pneumonia. Although it starts as a flu or a common cold, but it can aggravate to pneumonia. So its sign and symptoms usually mimic that of the cold, but however, its complications are really grave. So this is what a nurse has to understand, how the sign and symptoms of a common cold are different from the flu and how they are different from COVID-19 infections. The next thing is that what we will talk about is what is the course of the disease. The disease is itself divided into various stages. The first stage is ischemic stage, in which there is inflammation of the mucous membrane of the nose, eyes, eustachian tubes, and so on, which is triggered by IgE mediated response. Then there is hyperemic stage, in which there is rhinorrhea, there is blocked nose, anosmia, headache, fever, and discharge. And here also IgE antibodies play their role. They coat most of the cell and cause the release of mediators like histamine, tryptase, and also various neutrophils and eosinophils. They come to the part and increase the infection. Then there is stage of resolution. Once the infection has increased, obviously the infection will decrease. So there is a stage of resolution which occurs in 5 to 10 days. So usually when the people have common cold, in the midway they have high infection and they can cause more infection to other people, but slowly it resolves over 10 days. So whenever there is a viral infection, your doctor or your nurse would obviously tell it that it is going to resolve within 10 days and there is no need to take any medication. So at that time, rest and plenty of fluids are actually what is told to the patient to be taken. The next is, how do you prevent this common cold? Common cold is very common, so it is also very contagious. It can easily spread from one person to another, because when one person sneezes, the infection can be easily transferred through hands or through air to the other person. So first thing is that we must avoid contact with the others during the time when we are having common cold. So it is important to take rest during that time. And a person who has such symptoms should avoid going in crowds, should always cover their face and their mouth, and avoid sneezing and coughing in front of the people. Rather, they must practice the guidelines which have been given, like you can either use handkerchief over your nose and try to avoid sneezing in the public. Then you have to carefully dispose of any kind of tissues that you are using. The patients are also advised not to blow their nose unnecessarily or blow their nose too hard, because this affects the nasal mucous membranes. Then it is also told to the patient to always blow the nose with the mouth open slightly and with the nostrils open to prevent excessive pressure and to prevent the infected matter to enter into eustachian tube. Your eustachian tube is actually the tube which is a kind of connection between your nasal passage as well as your ears. So any kind of infection, if it is in your nose, it can easily climb up to your ears and cause middle ear or outer ear infection. So sneezing and coughing must be done not with much force, but must be done softly. Then what is the management? A common cold is usually managed as a self-limited condition. Doctor will tell you to rest and obviously drink plenty of fluids. Then bed rest is also advised. You have to avoid chilling, and you are also advised to take lot of fluids and a well-balanced diet. It is also told to take warm salt or warm salty water when mild fever occurs during the first 2 days. Antibiotics at that time are not indicated, because especially at that time it is mostly viral. Analgesics to relieve the pain, decongestants and antihistamines, and even vitamin C is prescribed to build up your body and improve your immunity. The other kind of rhinitis is allergic rhinitis, which is usually associated with seasonal allergies, and it is also known as hay fever, and it can be acute or ongoing chronic condition. It is characterized by continuous sneezing. The patient may also have nasal obstruction. He can have lot of tearing. There can be thin nasal discharge all time long. You can also, the patient will also say that there is a frontal headache in his head, and obviously he will also say that there is itching in his eyes. It affects the young adults as well as young children 5 years onwards, and both the sexes are or the genders are involved. It can be seasonal or continuously present. So these are the symptoms of allergic rhinitis. Usually there are swollen sinuses, mucus as well as allergens are there, and usually the patient has a itchy nose, there is sneezing and watery eyes. What are the causes? As I already told, it can be hereditary or hormonal changes in the females during pregnancy or puberty. There can also be change in humidity and pollution. There can be other reasons like inhalants, dust, pollen, animal odor, wool, and so on. Then a person may ingest something which can cause allergy like egg, fish, milk, citrus fruits. Contactants like sometimes cosmic powder or even talcum powder sometimes gets into your nose and cause sneezing. There are other causes like inside your body there can be changes like butyric or intestinal helminthic infection which may lead to problems and increase allergic rhinitis. How do you prevent it? You have to eliminate or limit the intake of chocolates, milk, and eggs, or whatever allergen you are allergic to. You should cover the mattress and pillows with plastic so that no allergens are allowed to settle down there. You should avoid touching the domestic animals because they are also the source of allergy. You have to use non allergic cosmetics if you are allergic to any of the chemical within the cosmetics. You should install an air conditioner within your house. You should also try to cover the furniture and use antihistamines as prescribed. What is the management? Try to find what is the allergen that is causing you the allergy. Then you should also take a well balanced diet. Your treatment should include antihistamines, steroids if required, vitamin C, and calcium. Sometimes your doctor also recommends nasal corticosteroids, intranasal anticholinergic agents along with mucus thinning agents. Nasal wash can also be prescribed. So as a nurse, we have to help the patient to understand why he requires all these things and utilize them for the patient in the hospital and teach them when they go home taking all these medications with them. Then local treatment can also be used like hydrocortisone injection, then zinc ionization and cryosurgery can be used. Surgical interventions may or may not be required, but sometimes they may be required to treat the allergies if it is causing obstruction and frequent infections. The next problem is sinusitis. There are four sinuses as you can see highlighted in green color as well as yellow color. These four sinuses can have infection and this leads to inflammation and also mucosal changes which is known as sinusitis. There are various causes. Most common is the allergy. Then the associated rhinitis can also cause sinusitis. There is spread of infection from the nasal passage to the sinus. It can get blocked. There may be an obstruction. There can be deviated nasal septum. Polyps can be there. Edema of your nasal area can be there. Common cold, respiratory infections, and even influenza flu can be the common causes of sinusitis. So basically, the infection which is in your nose can actually go into your sinuses and create the inflammation. There are two types of most common sinusitis. They are acute and chronic. Acute sinusitis is the inflammation of the sinus which is characterized by malaise, lack of appetite, nausea, nasal obstruction, congestion, purulent that is pus-filled nasal discharge, cough, sore throat, orbital edema or swelling over the sinus. Because of the sinusitis, what happens, this since it being acute sinusitis, it just develops very quickly and also resolves quickly on its own. You however may require some medications to be given in this case. There are various causes. It can be associated rhinitis infection, pneumonia, influenza, allergies, abscess of the teeth, and these abscesses usually occur after the tooth extraction. We have already talked about certain clinical manifestations. However, I would like to say that headache and pain over the eyebrows, between the eyes, depending upon which sinus is affected, is usually seen. There may be obstruction, congestion of your nasal area, there may be pus-filled discharge, cold cough, and sore throat are very common. How do you manage these patients? Management is just like rhinitis. You need to provide them with nasal medications like drops and sprays. Even nasal various drops can be given to the patient and nasal washes can be prescribed. The person can also be given nebulizer or nebulizing medications so that the infection is resolved and patient can breathe easy. These nebulization also helps to relieve any kind of congestion which is there and also helps to breathe nicely. Sometimes vasoconstrictors are also given because it is given in order to decrease the lumen of the blood vessels and decrease the blood supply, which reduces the inflammatory response in that area. Chronic sinusitis, as the name suggests, chronic sinusitis is the sinusitis which develops over a longer period. and when there are repeated sinus infections. Hence, because it has developed over a lot of period, it requires lot of treatment and sometimes it becomes difficult to treat. Symptoms are similar to acute sinusitis. However, patient may be lethargic, he may have difficulty sleeping, there will be chronic cough for a long time, the patient may lose ability to smell, and there may be chronic sinus headache and dull pain over the area. We can give lots of things for the management. If the patient is having pain, we can give him analgesics like salicylic acid, codeine, along with the decongestants. We also can give him steam inhalation, nebulization, and antibiotics. It is important that the patient is told to rest and well balanced diet is given to him along with fluids. Nasal sprays, nasal drops are also important. It is also important that if he has any nasal defect, that is corrected. It is also important any kind of diseased or old mucous tissue which is creating obstruction is removed, and surgery may be done to enlarge and create sinus to eradicate the infection. The next is epistaxis. We all understand what is epistaxis. It is known as nose bleeding. It is usually a symptom of any other developing disease. Sometimes it can be life threatening, but most of the times it is not, and immediate treatment is actually the prompt response you can give to the patients. It is of two types: anterior nasal bleeding and posterior nasal bleeding. In anterior nasal bleeding, anterior part of your nose or the front and lower part of the nose usually gets to bleed, and the most common site is nasal septum, but it is easy to control. In the posterior nose bleed, it is not frequent. However, the posterior part is affected. It is common in older people. So what is the main cause? Trauma, high BP, sometimes excessive nose picking, accidents, fractures, infections, deviated nasal septum, growths in the nasal cavity, and other heart diseases, bleeding disorders. Sometimes when person goes on trekking at the higher altitudes, at that time also epistaxis can occur. So most common symptom is nose, in the nose, because nose has a rich blood supply, so there is chance of the breaking of the nasal vessels, and as a result they breathe easily, bleed easily. The bleeding may be from one or both the nostril. Person can also swallow the blood which may come in the stool. If lot of blood loss is there, patient can go into shock. There can be dizziness, weakness, and also confusion. First aid involves the nose is pinched with the thumb and index finger for 5 minutes as it is shown in the figure. Most of the bleeding gets stopped by this method. Other way can be applying ice cold water to the head or face, or ice packs to the dorsum of the nose to avoid the bleeding with the help of vasoconstriction. Another method as shown in the figure is Trotter's method, in which patient is made to sit leaning forward and a basin may be given to him so that he can spit out any blood which is coming in his mouth. Further management can be sedation. You can try to sedate the patient for 50 to 100 mg pethidine. There can be cauterization and anterior nasal packing can be used. After cauterization of the area, we can utilize silver nitrate or coagulation with the electrical cautery. Posterior nasal packing is done for the bleeding in the posterior side, and usually post-nasal packing is used. We can also use endoscopy, with the help of which cautery can be introduced in the nose, and hence the bleeder can be stopped. Cryosurgery as well as embolization can also be used. One also can do a surgery and ligate the blood vessel. This is a diagram which shows the anterior nasal packing. So the layers of gauze are soaked with the help of forceps. They are introduced in your nose if there is anterior nasal packing is required. For posterior nasal packing, a hose is usually introduced and the pack is inserted in the posterior side of your nose, and then it is fixed in its place with the help of the lumen and the tube. So how do you manage? You make the patient sit up with the backrest. You check and record the blood loss. If there is any because of spitting and vomiting, you reassure the patient. Mild sedative may be given. You must observe the patient's vital signs and seek that the patient is not going into shock. Blood samples are also taken in order to see how, if there is lot of blood loss and the patient is going into shock, we may require this to get the blood for the patient, and blood transfusion may be done. Antibiotics, intermittent oxygen if required, vitamin C and calcium is indicated. Next is nasal polyps. As you can see, nasal polyps are just like non-cancerous growth in your nose. These are non-neoplastic in nature, but they cause lot of edema. They can occur because of any chronic allergies or non-allergic rhinitis, because of which there are abnormalities and these growth are created within your nose. What happens is that when these are present, the symptoms include nose obstruction, rhinorrhea, loss of smell, lot of headache in your frontal part of your head, and then broadening of the nose, and this causes a facial deformity which is known as frog face. Your nose is going to become like a frog, and hence, because there is stretching of your nose, as a result of this, the patient is told as to be a frog face. How do you manage? The polyps are usually removed with the help of surgery, which can be polypectomy and so on. Even endoscopic surgeries can also be used. Treatment can also be, if the polyps are very small in size, there can be use of antihistamine, antibiotics and steroids. The nursing care involves administration of medication and caring of the patient during the surgery and also post-operative care. Nasal obstruction. Nasal obstruction, as you can see in the figure, the normal nose has a normal opening, whereas the obstructed nose has a presence of obstruction on the nasal side. So what happens here is that there is blockage of the nasal passage, which is associated with local discomfort. There is also nasal discharge, which causes difficulty in breathing. This may also lead to mouth breathing, because the person may find it difficult to breathe it through the nose, and hence when you breathe through are able to breathe through the mouth, obviously there will be dryness in the mouth and there will be a persistent sore throat. So this problem is not only affecting your nose, but because of mouth breathing, it can also start affecting your mouth and increase the chances of throat disorders. So what happens is that in case of acute nasal obstruction, which develops as a result of sudden causes, it can occur due to trauma, which leads to hematoma and hence deviated nasal septum. There can be vasomotor rhinitis or any kind of seasonal allergic rhinitis, which leads to swelling in your nasal mucosa, which can cause nasal blockage, and this blockage can be of various severities, but this will obviously cause some kind of obstruction in your nose. Then there can be a long standing nasal obstruction or chronic nasal obstruction, which is caused by persistent deflected nasal septum, if it is not treated surgically or medically. Or there can also be a nasal polyp, which can lead to this nasal obstruction. As a result of this, this nasal obstruction can continue for a long time. Your nasal obstruction can also be identified as unilateral, that is affecting only one side of the nose or one ear. It can be bilateral, affecting both the ears, or it can be perennial, affecting both sides as well as continuing for a long time, which is known as long standing. So how do you treat this obstruction? If there is a rhinitis, which is of any kind, we usually treat the patient by using antihistamine and nasal decongestants. There can also be another chronic hypertrophic rhinitis, which continues for a long time with the help of diathermy, which can cause some effect on your internal mucosa. You can also utilize some surgeries for deflected nasal septum, which can be septoplasty. Then for the nasal polyps, polypectomy can be used. So we usually give the treatment depending upon the cause of the problem, which is causing nasal obstruction. And if we are able to reduce or deal with the cause, we are obviously very good at dealing with the nasal obstruction. Then nursing care. Nursing care in such a patient involves providing comfort by giving nasal drops and medications. Patient must be told to avoid driving if they are using antihistamines. That is also common for any of the nasal problems in which the patient is taking antihistamine, because antihistamine will cause a certain sedative effect and make you sleep. So it is not good, or it is important to avoid driving for these patients. Then the nurse must also teach the patient to avoid any kind of allergens or any kind of conditions which can cause the increase in allergies. And if surgery is done, pre and post operative care of the patient with the surgery is usually taken care of. Sometimes nasal surgery is also done, so that has to be taken care of. The next is deviated nasal septum. We have a septum which divides our nose into two parts. So when this nasal septum is also gets effective, this leads to the problem. So when your septum gets effective, it can be either any way round, so it leads to deviated nasal septum. So what happens in this case is that it can run in the families, and it is the common cause of the deformity and the nasal obstruction. As you can say, this nasal septum which is coming has deviated. It should be a straight line, however it has deviated to one side of the face. So this leads to obstruction on this part of the nose, and hence nasal obstruction can also occur as a complication. The causes can be trauma, congenital deformities, and even birth defects. What happens in this case is that the symptoms are usually obstructed nostrils, which cause difficulty in breathing, nasal congestion, nose bleeding, frequent sinus or nasal infections. Patient can also snore in the night, and there can also be noisy breathing during the night, especially when the patient is sleeping. So whenever a patient comes to you with lot of snoring and noisy breathing, please try to suspect them as deviated nasal septum or something which is associated with their throat or nose disorder. Now, how do we manage it medically? The medical management of this involves decongestants, antihistamines, nasal cortisone spray, and sometimes postnasal drip. Surgical treatments involve septoplasty, in which the septum is usually incised and it is made into a straight line. We try to align the septum with the use of sutures and splints. Then submucous resection can be also done under general anesthesia, in which the nasal nose is peeled off and certain lining of the septum is removed, the cartilage and bone is removed, and we try to do a cosmetic surgery to improve the nose. Now, what are the nursing interventions? We need to tell the patient that he will be discharged on the same day when the surgery is done. Analgesics are given to reduce the pain. Cold compress and eye packs are applied for 24 hours to reduce the edema. This can also have an effect on the patient's pain. Head is to be elevated after the surgery for at least 24 hours or as prescribed. We need to change the dressings and observe the patient for any bright red frank bleeding. Follow-up care is as prescribed. Now, as nurses, we need to have a knowledge about the nose disorders, and we need to be vigilant about the arising complications. With this, we come to an end of the first session, in which we talked about the various nose disorders, the nasal obstruction, nasal polyps, and also the deviated nasal septum, and the various infectious conditions, that is sinusitis and rhinitis. As nurses, we should know what are the symptoms, what happens in these diseases, what can you as a nurse help the patient with, trying to understand their condition in the medical and the surgical management, and also your interventions. So with this, we come to an end of this session. Thank you so much.
Do you know that the world's population has reached 8 billion on 15th November 2022? And we are still counting. I don't know where do we go from here. The predictions are scary. Any idea how many people can Mother Earth sustain? India's growing population is a serious concern, and we are soon going to become the world's most populous country. Wow, number one. Population is, after all, a human issue. The UN proposed Sustainable Development Goals cannot be achieved unless and until we consider the population dynamics. So, here we are. Indira Gandhi National Open University offers appreciation course on population and sustainable development. The course explores the linkages between population and sustainable development. In this course, there are diverse issues related to population, environmental safety, livelihoods, human health, migration, urbanization and much more. The course duration is 3 months, but of course, you can complete it within a year. The eligibility.
Welcome dear students to this session on the management of patients with throat disorders. In this session we will talk about the various throat disorders. We will also talk about the management, clinical symptoms as well as how nurses can care for these patients who are having throat disorders. So a throat, as you can see, is something which involves your mouth as well as glands inside your mouth. So when anything in this gets affected, you have a throat disorder. So there are various disorders of the throat and it is important for the nurse to learn about them. First and most important disorder is tonsillitis. Tonsillitis is also very common in children, but it has also become common in adults now. This is known as the infection and inflammation of the tonsils. You can see tonsils are the small glands within your mouth, and when these get affected, there is throat redness, whitish spots, and your tonsils are swollen. It is known as tonsillitis. There are two types, acute and chronic tonsillitis. Acute tonsillitis is something which develops immediately or has a rapid onset. You can see in the figure how much swollen these tonsils are and they arise within small time. There can be various causes. There can be infections due to bacteria, streptococci, staphylococci, pneumococci or Haemophilus influenza. It can be also because of diphtheria and other viruses are also the commonest causes. Other conditions are upper respiratory infections, sinusitis, some low immunity or low body resistance, body dyscarrias. There can also be bleeding disorders within the body. Excessive use of cold drinks can be there. Children nowadays drink a lot of cola and Pepsi, and as a result of this, they usually fall prey to chronic infections of their tonsils and end up having tonsillitis, thereby going for tonsillectomy. There can be also the causes like pollution and foreign body impaction. Sometimes your nose infection and ear infections can also be associated with your tonsillitis, and hence a clear view of ear, nose and throat is required whenever you take your child or your adult suffering from tonsillitis to the doctor. What are the clinical manifestations of tonsillitis? The symptoms vary on what kind of infection you are having. It is usually the sudden onset of fever that is more than 40 degrees Celsius. The patient also has body aches, sore throat, is unable to talk. There can be painful swallowing. Sometimes the child can say that he is having earache, and then there can be associated symptoms like change in voice, trismus and malaise. Then there is variety of management on these patients. First of all is the bed rest. Patient is encouraged to take plenty of fluids. Antipyretics and analgesics are given to reduce the fever and relieve the pain and body aches. Antibiotics can also be given. Penicillin is the drug of choice. Soft, warm and simple diet is given to the patient. Saline or potassium permanganate containing water can be used, or even antiseptic gargles can be used so that your infection in the tonsil is relieved and some kind of pain and swelling is also acted upon. Vitamin C, D and B complex is prescribed, and lozenges with local anesthetic action can be used if there is severe infection in the patient. Then there is chronic tonsillitis. It is the tonsillitis which develops over a long period of time and due to recurrent infections. The causes and the predisposing factors are the recurrent infections of acute tonsillitis, which last for about 4 to 6 attacks in a year, can lead to chronic tonsillitis. That is why when you go to a doctor with a particular tonsil infection, they will try to conduct a whole diagnostic test on you so that they will realize whether it is recurrent or not, because recurrent infection can lead to the deformed mouth, the deformed teeth, as well as deformed nose in small children. So the evaluation in chronic tonsillitis is very, very important. Then it can also be subclinical infections of tonsils without any acute attack, which can be because of the ear infections or nose infections. Sometimes the causative organisms can be there and they are same as the acute tonsillitis. Now, what is a clinical manifestation in chronic tonsillitis? Obviously, all the symptoms of the acute tonsillitis, which continue for a long time, will be seen in the chronic tonsillitis. Then there will be recurrent attacks, chronic irritation. The patient or the child can have foul smell or bad taste in their mouth, difficulty to swallow, choking can also happen. Patient may not be able to sleep good at night and sometimes may have sleep apnea also, especially when the tonsils are enlarged. Patient may have lot of snoring or may grunt during the night. So you have to be very careful, especially when small children or adults are involved with tonsillitis. So how do you manage? There is a general management. In the general management, you have to reassure and you have to give attention to the symptoms and bodily changes that are occurring because of the tonsillitis. Good nutrition, increase in the immunity is very, very important for such patients. Antiseptic gargles for the tonsils and removal of any predisposing factor, pollutant can be done. Then we need to treat the infection by the antibiotics. Any coexistent antibiotics can be given if there is any coexisting infection. This can be infection of the nose, teeth, or sinuses, and they must be treated. In spite of medical treatment, if the patient continues to have frequent attacks, tonsillectomy can be done. So what happens in the tonsillectomy is that if there is a swollen tonsil, we can, under the surgery, remove these tonsils. There is recommendation of tonsils to be removed from both the sides because there are two tonsils, and when you remove these tonsils, they can be removed easily. It is a short procedure and patient can go home the next day. And after the tonsillectomy, it is usually told to avoid any salty or extreme sour things. The child or the patient is told to eat ice creams or chew on any ice cubes so that they do not feel. Initially, they may feel some pain, but over the time, this pain usually gets resolved. Then next condition is adenoiditis. Adenoiditis is sometimes also associated with tonsillitis. So what happens is in here is that there are certain adenoid glands present on the back of your nasal passage. These become hypertrophied. They can be involved in nasopharyngeal area, and these are known as adenoids. So when they become hypertrophied and inflamed, it is known as adenoiditis. So involution of this nasopharyngeal tonsils or adenoids usually starts at the age of 10 years and are completed by 20 years of age. So they are active till 10 years. The most commonly frequent infections mostly occur till the 10 years of the life of the child, after which they become small in size and are reduced. The next is adenoids are usually occurring between the ages of 3 years to 7 years, and they usually cause non-specific infections. Predisposing factors are upper respiratory infections, sinusitis, cold drinks, and ice creams. So what are the clinical manifestations? There are a variety of clinical manifestation. Patient may have nasal obstruction and there is a chance of mouth breathing, heavy snoring, drooling of saliva. The mouth remains usually open when the child sleeps or the adult sleeps in the night. Teeth may become protruded. Flat chest, which is toneless, is also seen. The eustachian tube obstruction can also occur. The deafness is also seen if this infection migrates to your ears. Throat infection and upper respiratory infection, bronchial asthma, bronchitis, nocturnal enuresis, as well as the patient may have nightmares or night terrors because suffocation may occur. Child becomes backward in studies because as oxygen or the air is coming less into your lungs because of the adenoid obstruction, the blood which is carrying this oxygen to the brain, the oxygen level in your brain will also decrease. So it is usually seen that it can cause a little brain impairment over the time if not rectified, or the child may become weak in study, may become lethargic. So parents or the patients whose relatives or family members are having such a condition are usually told towards removal of the adenoids and tonsils. So, what happens is that how do we manage? As already told, surgical management is usually done, which is known as adenoidectomy. If, however, the obstruction is not large and the adenoids are not much swollen, and we know what is the cause of infection, we can give antibiotics to control the infection. We can improve journal condition and hygiene. We can also advise the patient to do breathing exercises, deep breathing exercises, because it has been shown that this will improve the oxygen levels in their blood and also reduce any kinds of infection which is associated with sinusitis, rhinitis, which lead to adenoiditis. So this is what happens during adenoidectomy. Usually the child is laid straight or the adult is laid straight. The mouth is usually opened with the help of a clamp, and then the probe is usually inserted and guided, and then we remove the adenoid from this part. So this is the part where adenoids are usually present. The next problem is pharyngitis. Pharyngitis is very, very common, especially when you are drinking something cold or you have cold cough. So this is a associated symptom, but it is also disease within itself. So it is known as the inflammation and the infection of the pharynx. The pharynx is actually divided into three parts. Nasal part is known as nasopharynx, oral part is known as oropharynx, and your lowermost part is known as laryngopharynx. So infection in any of the part, especially your oropharynx, can lead to pharyngitis. So it is of two types, acute and chronic. So first, acute pharyngitis, it is caused by a viral or a bacterial infection. It can affect the sinus as well as nose. It is very, very common, and it is also known as common viral cold. The causes are many, and however, various kinds of streptococci, hemolyticus, the pneumococcus, and other flu as well as influenza viruses are known to act on it. Then clinical manifestations are marked congestion of posterior pharynx occurs, uvula becomes edematous, purulent discharge may be present, ulceration and gangrene may form as a result of this problem. How do you manage? As already told, we utilize the broad spectrum antibiotics. Antipyretics are used to reduce the pain as well as reduce any fever. Analgesics also help to reduce pain and swelling. Saline gargles are also given to the patient to soothe the throat. The patient is also advised to improve journal health by utilizing well-balanced diet and rest. Then what is chronic pharyngitis? It is a common condition of pharynx, and recurrent attacks of acute pharyngitis can lead to chronic pharyngitis. What are the causes? The factors or the risk factors are when the nose and paranasal sinuses block, the nasal sinuses get blocked, there is deviated nasal septum, the hypertrophied nasal area, mouth breathing is there, and rhinitis is there. These can be risk factors for development of chronic pharyngitis. If there is chronic tonsillitis or chronic dental sepsis, there may be bronchitis or bronchiectasis or even chronic pharyngitis. Allergic pharyngitis can also be one of the cause of chronic pharyngitis. Tropical eosinophilia and overuse of voice can also lead to chronic pharyngitis over the time. So we have seen that the people like teachers as well as singers, because they're singing for a lot of time and teachers are shouting at their students for a lot of time, these are the people who definitely would develop pharyngitis at one or the later point of the time. That is why when you advise a patient, they are told not to speak at a high pitch, at a high volume, and not to shout, and calm their voice if they want to get rid of pharyngitis. So there are other exogenous factors also which lead to this problem. There can be tobacco, smoking, pollution, and alcohol. There can be functional factors such as emotional factors or fear of malignancy or any kind of stress can also sometimes lead to pharyngitis. Other factors like hyperplasia, hypertrophy, there can be cysts in your throat that can lead to pharyngitis. Now, what happens is there, as you can see, this part is affected. This is the oropharynx. So, there is burning sensation. The patient may feel itching in the part. There is dry cough, pain, vocal fatigue. You may not want to talk. There, when you spit, it contains blood. There will be congestion of the throat, and follicular multiple yellowish cysts may also be present in your pharynx. How do you treat it? First of all, treat the cause. Avoid shouting or speaking loudly because it can increase your infection. Chemical cauterization can be used with 15% silver nitrate. Steam inhalation is given with tincture benzoin or menthol. Mendel's plate is applied locally. Elective cauterization of granules may be done. Tranquilizers can be prescribed. The other is a peritonsillar abscess. These are the abscess which is present in your tonsil and is known as quinsy also. It is the collection of pus in the peritonsillar space between superior constrictor and the capsule of the tonsil. It is usually present on one side. What are the causes? The patient may complain of tonsillitis and there may be a foreign body in the tonsil. Clinical manifestations are patient may look ill and febrile, there is painful swallowing, inability to open the mouth, dribbling and plummy voice. What is patient given is usually broad spectrum antibiotics, antipyretics, anti-inflammatory drugs, soft, bland and warm diet. The surgical treatment can be incision and drainage of abscess, tonsillectomy to prevent the recurrence. So what happens in this case is that we will use a needle guard. As you can see, with the help of the needle guard in the tonsil, we will try to take out any kind of the pus which is present so that we are able to help the patient. So next we will talk about the general nursing management. There is a risk of infection. We'll tell the patient to avoid frequent touching of the organs like nose and tonsils. We will follow complete aseptic procedures during care and surgery. We will monitor for the compliance to the medication regimen and we will use good hygienic methods. We will also assess the return in the function after treatment or the surgery. We'll change the dressing and check the drainage. We'll also wash hands frequently with the soap. So this is what the nurses need to do if there is high risk of infection. Next is the risk of injury. When there is high risk of injury, especially in these patients, especially those suffering from tonsils and nasal problems, we need to provide a good diet to the patient in order to improve on any kind of complications that are occurring. We need to administer pre-operative and post-operative medications and avoid any complications. Avoid putting pressure on the dressings. Avoid violent coughing, sneezing and vigorous nose blowing. Avoid vigorous physical exercises for 1 to 2 weeks and we need to be careful when the packing is present. Either it is in case of nose or tonsil problem. Comfort and relief of pain is very important, especially after the surgery. So in this case, we should position the patient properly, especially in the mid or high fallers position. We need to give an analgesic to relieve the pain and avoid the aspirin and apply ice collar to the neck. Monitor and control the bleeding. We need to monitor the vital signs, check sputum and vomitus for blood, take ice cold fluids and apply ice collar to the neck. We need to give vitamin 500 mg daily. Avoid any kind of attempt to clear the throat immediately after the surgery. Other important nursing diagnosis as well as nursing care that you will take is to provide nutrition and the fluids. In all the nursing management, I have told that you need to provide calcium, you need to provide vitamin C, and you need to provide well-balanced diet to the patient. Because all these problems are actually associated with the presence of not having good immunity. So proper diet is very important, rest is very important so that you are able to provide the patient with the help to yourself recover from the problems that are associated with the throat. So we need to give ice cold drinks and fluids sometime and a well-balanced diet. We should tell the patient that milk may be avoided, and because it leads to high mucus secretion, and also the first liquid diet, then semi-solid diet after the surgery, and then solid diet after several days of the surgery. Patient is also told to avoid the reinfection, in which reinfection can be helped is by meticulous care of mouth and teeth to be taken. The patient is also advised frequent antiseptic mouthwash and toothbrushing. Antibiotics are given in full dose. Promotion of deep breathing and coughing to prevent atelectasis and aspiration. The patient may also have deficient knowledge. They may not have a knowledge about this. Then we need to educate the patient about his condition and prognosis. We need to take informed consent if surgery is scheduled. We need to ask the patient to rest after the surgery, avoid wetting the area of the surgery, avoid unnecessary bending and weight lifting, and remember the rules of safety to avoid injury and complications. Now, other important thing is that you need to tell the patient to avoid blowing the nose, because in this case the infection can also travel from your nose to your tonsils as well as your ear as they are connected to the eustachian tube, as I've already told in nose disorders. So what happens is that when the infection travels from the source of primary infection to the secondary infection, there are chances of more chronic problems to grow. So when one primary infection can travel to secondary infection place, a chronic pharyngitis or chronic tonsillitis can occur, which is sometimes very, very difficult to treat. Then we need to also tell the patient or teach them about the stress reduction techniques, because I have told you sometimes pharyngitis may be associated with the stress, and sometimes your tonsillitis can also occur because of pollution and repeated stress. Stress in the form of food you eat, and like Pepsis, colas, or any kind of carbonated drinks can lead to increased chances of throat disorder. So, such kind of mental as well as physical stress should be avoided if a patient wants a relief from the throat disorders. Then you should try to keep the nose as well as the mouth moist most of the time, because your mouth during these problems, sleep apnea may occur. There is mouth drying, so the patient must be told to keep his throat moist. Then obviously the nose is also to be kept moist. The nasal washes and nasal sprays must also be utilized, because when this helps to liquefy your nasal discharge. Once your nasal discharge is liquefied, it does not become hard inside and create obstruction. It will be allowed to pass out, and hence when it is allowed to be passed out, it will lead to reduction of the microorganisms within your body. The reduction of microorganisms in your body will obviously help you in decreasing the chances of increased infection. Then the other thing is to avoid exposure to the irritants or the allergens. We have learnt in the throat disorders that there can be various allergens that can cause the disease. These allergens can include pollutants, they can include the exogenous as well as endogenous sources, as well as carbonated drinks. So when we are helping a patient who is having throat disorders, these irritants and allergens should be allowed to stay off the table. So with this help, we can help the patient by reducing the chances of getting the infection. The other thing is to have avoidance of the alcohol. Alcohol and smoking in any state can lead to aggravation of the clinical manifestation and the symptom. Hence, they should be avoided. We need to avoid hard and starchy food till your throat is healed. Why? Because this can obviously lead to injuries on your mucosa. When there are injuries on your throat mucosa, it can increase the chance of having throat infections. When the throat infections get increased, you will require a medical as well as surgical treatment. So that is why we should tell the patient to avoid hard starchy food. These foods can also be the source of infections and irritants. Lastly, we need to tell the patient to have the drinks and fluids for a few days until the mouth odor disappears. Now, when the mouth odor disappears, it is important that, especially in the cases of patients with tonsillectomy, it is very important, and adenoidectomy also, because mouth odor is present. The patient needs to have drinks and continue with the fluids, which is also a part of a well balanced diet for the patient. So, with this, we come to an end on our discussion on throat disorders. We discussed about various throat disorders. We talked about tonsillitis. Tonsillitis is of two types, acute and chronic. And we also talked about adenoiditis. We also talked about surgery for tonsils as well as adenoids, that is tonsillectomy and adenoidectomy. In many patients, the doctors recommend, if both of these are swollen, adenoidectomy and tonsillectomy are usually done together at a one go. Then we also talked about peritonsillar abscess, which is quinsy. It is a abscess which is usually present in your tonsils. And we also talked about how do we manage these patients and what nursing management can you give to these patients. The nursing diagnosis and nursing needs being reducing the risk of infection, reducing the risk of injury, telling the patient, reassuring the patient, telling the patient about what advices they need to follow when they go home or when they are in patient department. Also, we need to tell the patient about the recovery from the various surgeries and how do they need to care for themselves when they go back home. So with this, we come to an end of the various throat disorders and how can nurses help manage these patients with throat disorders. Thank you very much for being a part of this session.
Are you a fresh graduate? Do you want to fulfill your educational aspiration by pursuing higher education in various interdisciplinary and multidisciplinary areas like environmental science, environment and occupational health, philosophy, sustainability science, folklore and culture studies?